you know, this year we are honoring you at City Congress, as we were discussing before. So I would like to have your opinion, your personal opinion on Krassi Ivancev. How do you feel about yourself, and how, in which way have you influenced yourself? Because you have influenced so many people around the world that it could be impossible that you cannot have influenced also yourself.
But you know, Milo, when you ask such a question, it's almost asking the impossible, to get myself outside myself, look at me and see this man is something I know about him, but I have to tell you more than what I know about him. And it's hard to tell, but one thing I can tell you that it's been incredibly enjoyable journey to be involved in a new field that is constantly evolving. It has been incredibly rewarding to meet so many people and to learn from them, and certainly learn constantly something new. And with that, what I mean is not only that I've been trying to transfer over my knowledge and cut through wires, which I look at it like something very simple. They're simple mechanical instruments. But in return, I've obtained so much of an insight of how people think differently, and they certainly do that. They're different, like surgeons and radiologists, they think differently. They have different approach, but to combine all of this together, that's what I think has been, let's say, the most characteristic feature of if somebody like called Krassi is, you know, to combine the different.
Thank you very much. It has been a completely pleasure to have you here today. I hope you enjoy this fall for an interview, and I hope you enjoy the rest of the Congress. Thank you for being here with us.
Thanks, man.
You know, this year we honor Dr. Krassi Ivancev, and I'd like to have your opinion. What means Krassi Ivancev for you, and how did he influence your practice or your knowledge through all these years?
I think we all agree that Krassi it is a well-known reference for all of us, not only in Europe, not only in our countries, but in the world.
He's trained many surgeons, which have, I suppose, upset some of the interventional radiologists. He's trained me, even though for short periods when I've talked to him or visited with him. So I think he is a true hero in the advancement of treatment of vascular disease, and he should be honored as a pioneer.
If you look at the people that he's taught, Martin Molina, Roy Greenberg, Stéphane Hollin, it is a huge pantheon of influence that he has. And when you meet him, you understand that there is nothing that cannot be treated endovascularly. He's a true pioneer. He's one of the greats.
If I think of some of the brightest people that have contributed a lot to our field, whether it's Roy Greenberg or Tim Shooter or a variety of other people, all of them have learned their skills and their early introduction to endovascular therapy in Malmo with Dr. Ivancev.
Krassi has the combination of being inventive and being very critical to his own work. So when he is doing new technologies, he also evaluates it very transparent, and that brings him to a higher level. He's not only an adventurer, but he is also a contributor to new technologies in the endovascular therapies.
Well, I think CITA made an excellent choice honoring Krassi Ivancev for his career, and I think for all of us, he is one of the pioneers of interventional aortic treatment, endovascular aortic aneurysm repair.
Krassi is a very unassuming genius. He really is one of the pioneers in terms of thinking in his own way, independently, and that's what we need.
the ideas that he promoted and actually are being seen today with different companies developing this technology is a major step forward to treat most of the patients with regular aneurysms.
Krassi is a deep thinker, analyzer, cares deeply about his patients. This is the thing that impresses me most. So he believes very much that he should see the patient beforehand, he should work them up, he should do the operation, he should teach and train during it, and see the patient afterwards until they've gone.